So we're starting with counseling on myomectomy. So myomectomy actually came out in previous exams, and it's a very high thing everybody should know ahead of the exam. So another name for it is also known as the fibroidectomy. So I'm not going to, as I've always say, if you are watching this video for the first time, you need to watch Introduction to Counseling first, so you understand the whole thing about counseling, how to go about it. Here, I'm just going to give the breakdown. So there's an acronym you use for counseling, which is GADA. So I'm not going to be doing the G part and the A part. For you to understand the G part very well and the A part, go to our previous video. You will see it. I'm going to start from the tell part. Tell means you tell everything you know about that topic that you are being given, that case. They're going to give you a case. They're not just going to give you cancer myomectomy. They will present it. 35-year-old woman came to the hospital with so and so. You've been asked to counsel her on the need to do so operation or something like that. So you know you have been asked to cancel fibroidectomy. So we want to start with definition. What is fibroidectomy or myomectomy? So your definition is very important. Fibroidectomy or myomectomy is a surgical procedure to remove uterine fibroid. Make it as simple as you can. Don't forget, it's also known as what? Fibroidectomy. Yeah. So that is myomectomy. So quick one, you want to say some few things about fibroid before continuing when you are counseling. So you tell about fibroid. So what is fibroid? And doctor, what is fibroid?
It's a benign tumor of the uterus.
Yeah, benign tumor of the uterus, or of the smooth muscle of the uterus. So you explain that quick, and you talk about the epidemio, the pathophysio. You want to talk about the, let's say, the epidemiology. So it's very common. It's common among which community, doctor? The black.
The black.
Yeah, very, very common among the black community. So among the black race. Very common among black race. Then, and is the most common tumor, the most common benign tumor in women of reproductive age. Don't forget. Then pathophysio. You are not wasting much of your time. Just few things. Pathophysiology you want to tell them is, you want to explain to the woman is estrogen dependent tumor. So this tumor is very common in reproductive age because in your reproductive age you produce estrogen, and this tumor grows as there's increase in level of estrogen. So it's estrogen dependent. Okay, so the estrogen dependent tumor. Full stop. Then you want to give quick one about the risk factor to this tumor. Bearing it in mind, you're not canceling fibroid. We are doing myomectomy. But I feel it is very important to say one or few things before diving into myomectomy fully. So the risk factors, of course, black race, nulliparity, you are very correct. Nulliparous women or nulliparity. People with family history.
Yeah,
family history. People who are taking combined oral contraceptive pills, OCPs. They are also at risk. Obesity, etc. That's enough. We don't have to talk so much about it, but just few things you need to just remind the patient about. So having to explain all this, the next thing you also want to talk about, very important, is reason for the removal of fibroid. Why should a fibroid be removed? So you want to counsel the patient about it. So reasons for removal of fibroid. So what are the reasons why you should remove a fibroid from somebody who is having fibroid? So first, obviously, don't forget the symptoms of fibroid. You might be presented with pain. So you might want to just to relieve or to alleviate pains. Are you getting me? To remove pains. So to reduce pain. So you might remove fibroid because of pain, just to reduce pain. So that those might be some of the reasons why you remove fibroid. Please take note, doctors. And apart from that, also from reducing pain, or let's say reduce pelvic pain, please. Let me put it there, pelvic pain. Pelvic pain. And also to reduce menstrual flow. Don't forget, somebody who is having fibroid is having
Mineral.
menorrhagia, metrorrhagia, menometrorrhagia. The patient is having everything. So to reduce menstrual or to reduce heavy, let's say heavy menstruation or heavy menstrual flow. Apart from reducing menstrual flow, also you want to stop irregular bleeding. Stop irregular bleeding. Stop irregular bleeding. Also to prevent prior symptoms or to stop or prevent prior symptoms. These prior symptoms, you know what are prior symptoms? You know when somebody is having fibroid, it can compress the nearby organs, the adjacent organs, resulting into what
Yeah.
is called prior symptoms. It can compress the ureter, causing increased urinary frequency, things like urinary frequency of urination. It can cause urinary frequency, let's say frequency of urination. It can compress the rectum. When it compresses the rectum, it can cause constipation. To reduce all these things like constipation, it can compress the inferior vena cava. In a pregnant woman, it can go and compress it, and if it compresses, it can result into things like hemorrhoid. It can result into hemorrhoids. You understand? It can result into hydroureters and so on and so forth. Please take note, okay? So also, the reason why we also remove it is also to give a proper outcome, a pregnancy outcome, proper pregnancy outcome. So let's say to give a proper pregnancy outcome. Please take note. Okay? To give a pregnancy outcome, especially for those that still want to be a child. You understand, doctor? So you explain this to the patient that these are the reasons why we do or why it's important to do myomectomy. And haven't you explained all this? You also want to explain to the patient the types of myomectomy. So there are different types of myomectomy you need to explain to the patient. So this is also important. You need to explain. So the types of myomectomy. Types of myomectomy. So there are three major types you want to tell the patient. The first one is the abdominal myomectomy. We talk about the laparoscopic myomectomy. Laparoscopic myomectomy. We talks about hysteroscopic myomectomy. So these are the types of myomectomy you probably explain to the patients about. So you start with the abdominal myomectomy. What is abdominal myomectomy? So it's very short to doctors. Please, you don't waste much of your time explaining, very quick and fast. You explain to this patient. So for the abdominal myomectomy, let's start with abdominal myomectomy. Abdominal myomectomy. For abdominal myomectomy, is when the surgeon make an incision. Let's say when surgeon makes an incision. The surgeon makes an incision. Hold on. There's a noise coming from the other side there. Hold on. So is when the surgeon makes an incision on the abdomen. On the abdomen. So an incision is made on the abdomen, either a vertical one, either vertical or horizontal. It doesn't matter. So just know that for this, an incision is made on the abdomen, the anterior abdominal wall, to remove fibroid. To remove fibroid. So this is referred to as the abdominal incision, and mostly this incision is always indicated for somebody who is having a very big fibroid. For example, somebody who is having a big fibroid. This is indicated for big fibroid. So indication to it. Indication is when somebody is having big, or let's say large fibroid. These are indication to abdominal myomectomy. Okay. So the other types of myomectomy we'll talk about is the laparoscopic myomectomy. So what do we mean by laparoscopic myomectomy? Laparoscopic myomectomy. So here, a minimally invasive procedure in which where holes are just being bored. Okay, holes are bored in this case. Let's say is a minimal invasive procedure. Minimally invasive procedure where, let's say, where hole are bored and a scope. They just put a scope. Okay, where hole are bored on the abdomen or on the anterior abdominal wall for removal of fibroid. So doctors, please, this is very important. Just small hole, just so that the scar won't even be there. After the procedure, you might not see scar. And these are mostly indicated in smaller, what's it called? Smaller fibroid. When the size of the fibroid is not that big. Indication. Yeah. Indication is when let's say small fibroid. So the size of fibroid will also determine which of them you are going to use. I don't know if I'm making sense.
Yes, doc.
All right. So the last one you also explain to the patient is the hysteroscopic myomectomy. So what do I mean by hysteroscopic myomectomy? Here is more of like a transvaginal. Okay. So a scope is being used, is required for this procedure, and the scope is used transvaginally. So you pass through the vagina and to remove, and you check everything properly and to remove the fibroid. So this one is transvaginal. No special incision is made in this case. Please take note. And also this is used for smaller fibroid, or maybe fibroid that is around the cervix area. Sometimes you pass it through the cervix. Okay. So let's say in this case, a scope or a special scope or instrument, you can tell the patient a special instrument is required. Please take note, is required and pass through the vagina or cervix for removal of fibroid. Please don't forget the indication for this one is for smaller Indication is for smaller fibroid or smaller fibroid. This is when you use your hysteroscopic myomectomy. Please take note, okay? So after this whole thing, you want to explain to the patient about postoperative, preoperative, and postoperative cares. So there are some postoperative care that you'll be doing that you need to explain to the patient. They are very important. So what are the postoperative and preoperative care you want to assure the patient about before myomectomy? So preoperative care, preoperative care. There's some certain things you do to the patient. So you give medications. What kind of medications? Medications to reduce the size of the fibroid. To reduce the size of the fibroid. So what kind of medication are you going to be giving to this patient? A medication such as your buserelin, your goserelin, your leoprolide, depending on which one is selected in the hospital. Okay, so this is a preoperative care. And apart from that, doctors, please, very important to do some certain preoperative investigations. Preoperative test is also very important. So under preoperative care, you will do preoperative tests. So what are the preoperative tests you want to do? You want to check the blood, the genotype, the group, the PCV, and everything. So blood test is very important. You check the PCV, is very important. You want to do things like ECG. ECG is very important also. You want to do ultrasound, pelvic ultrasound, to know the size of the fibroid. Please, blood test is very important. Your PCV and everything. You know this woman is already losing blood. You want to check the hematocrit and everything. Is very important. So apart from that, also you also want to, under preoperative care, you have to advise the patient. If the patient smokes, the patient needs to stop smoking, cessation of smoking, stop smoking. If the patient is a smoker, or any drugs or anything the patient is taking, the patient needs to let you know as a doctor. So as you are counseling the patient, you want to tell if there's any drug or any medication you are on, please, I would like to know. Okay, so any medication should be known to you. You understand? You have to tell the patient, or any disease or any existing disease, So these are the things you might want to ask the patient about. These are very, very important points. Do you understand what I'm saying, doctors? Please. So after, hello, doctor, can you hear me? You understand everything I'm saying? Hello? All right. Hello, doctor. So the other part that we'll be talking about that you also need to tell the patient is the complications. So let's talk about the complications. So you want to explain the complications. There's no surgery. You have to tell the patient there's no surgery without complications. So you want to explain the complication. Are you with me, doctor, please? Hello? Are you with me?
Yes, doctor. Yes,
all right.
Doctor.
So the complications could include things like what, sir?
Adhesions.
Adhesion, yes. Adhesion. Things like blood loss.
Yeah, bleeding.
Yeah, because the patient is losing blood already. What other things?
There can be infections.
Infections, I've written infections. Things like damage to organs also, doctor.
Yes.
Damage to organs. Organs could be damaged. There could be things like if the pregnancy, like if the person plans on giving birth again, like there might be complication to the pregnancy, let's say. You understand?
Yes.
There might be
Yes.
childbirth complication. Let's just say childbirth complication. Okay? Might be things like childbirth complication. And that's that about that. That's enough. That's enough. So some other things we should also talk about is, once you explain this to the patient, what are the strategies? What are the ways you are going to prevent this complication. It's very important for you to prevent these complications. What are the ways? So you have to tell the patient like ways of preventing or strategies of preventing the complications. So you want to assure the patient, you want to help the patient here. You want to tell the patient that you shouldn't panic. Prior to this time, we'll give you things like iron supplements. Iron supplement, vitamins should be given to the patient. Vitamin will be taken. Hormonal therapies, or maybe things, hormonal therapy. Things like, let's say, post-operative, proper pre-operative and post-operative care. Let's say,
Okay.
let's say, proper pre-operative and post-operative care will be given. Do you understand? So you want to explain to the patient what are the pre or post-operative cares that you do. Post-operative care. So you want to do what, doctor? Also, same thing. Nil per hose will be given to this patient. What other things? You want to rehydrate the patient now. Rehydration. Proper rehydration should be given to the patient. You want to do proper. What do you say, sir?
I said antibiotics for infections.
Antibiotics for infection. Okay. What other things? Pain. Pain relief.
Analgesic.
You want to give analgesic. You want to monitor the vital signs. Vital signs. Vitals. What other things, doctors? What other thing would you like to do for this patient? You might want to sustain a catheter. Catheterization. You monitor the urine output and everything. You understand? So don't forget proper bed rest. It's very important. So these are what you do to the patient, and you explain everything like this to the patient. So I think in summary, this is what you should cancel when you are canceling myomectomy. You talk very short, few things on myomectomy. The definition of the procedure of myomectomy. Then you explain what fibroid is. You give a quick one. You see, I just explained the pathophysiology. I didn't go into classifications of fibroid and everything. That one will be on fibroid counseling. We are going to do fibroid counseling. If you have enough time, you can talk about the classification. The, what's it called? Pedunculated, the submucosal, subserosa, intramural, and so on and so forth. So you can explain if you want. But if you don't have enough time, just talk about the risk factors, the reason why you do fibroidectomy or myomectomy, the types that we have, the indication for each, and the type. You explain just brief on each one. Then you talk about the preoperative care, what you have to do, and the postoperative cares, the complications. There's no surgery without complications. But you have to assure the patient by helping the patient here that even if there's going to be complications, you should be rest assured. And also blood, give blood, should be made available, should in case the patient go hypoglycemic. Do you understand? And there can even be complication as a result of anesthesia. Don't forget to include it also. So this is the summary of what you are going to talk about. I don't know if you understand everything, doctor, or do you have any question or anything?
Doctor, since it's a surgical procedure, I thought we're supposed to take consent, right?
Yes, you have to take consent. Since it's what?
Okay, like kind of consent form, since it's a surgical procedure.
Yes, you have to take consent. And that is why in the beginning, I didn't do the grit and the axe parts. Or which consent are you referring to, doctor?
Like, I mean, since it's a surgical procedure, we'll ask them to sign a consent form.
Yeah, you ask them to sign a consent form if they agree with everything. That is at the end of the counseling. And don't forget to always ask the patient to retell the arrow part. And very important to emphasize, to show empathy. I always say this empathy should not reflect at the end alone. From the beginning, you can empathize. These examiners want to see your empathy during this exam. So even when you are counseling and probably you forgot something, during the space of you forgetting, start empathizing. Before you know, you come back to what you remember what you want to talk about, then you continue. Do you understand, sir? Do you understand, doctor?
Yes, doc.
All right. Any other
Yes,
question?
thank you, doctor.
Any other?
No.
Okay, so that will be all for regarding counseling on myomectomy. Okay, so I will now encourage everybody that subsequent people that will be watching this video to make this thing you have to do within 4 minutes. So it's 5 minutes on the exam day. You have to say everything within, let's say, 4 minutes. You practice. You can record an audio notes. You can always send this to your friend. I don't know. You can always send it to me or something also. So I could listen very well and compare. So you practice. With practice, you can even do it. People do it within 3 minutes. You can say it within the 3 minutes. And that exam, some of the simulator might not respond to you, some might respond. So trust me, the time will be enough. Okay? All right, doctors.
Okay.
Thank you.